Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites fewmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the diseases of the mouth. Mouth is the starting organ of the digestive system, contains in the mouth the teeth, cheeks, tongue, palate, salivary glands, etc. Mouth acts for chewing food apart from digestion, tasting the food, etc. Receives the saliva from the salivary glands. In response to the different stimuli like taste, look, etc. It digests food by its enzyme, the ptyalin, which digests the polysaccharides to disaccharides and help to send the food into the next part, esophagus, with the help of the tongue. The teeth. Teeth are in different number, types and pattern for the sake of mastication of food, oral sepsis and respiratory infection may predispose to the disease of the teeth like ulcerative stomatitis and periapical abscess. Bacteremia from such source may after dental manipulation may cause bacterial endocarditis. In patients with valvular disease of the heart, so it is important to have regular dental checkups to prevent the foci of infection in the mouth. Stomatitis. Stomatitis is the inflammation of the mouth and is of several types as gingivitis, inflammation of the gums, chiliosis, inflammation of the lips, and angular stomatitis, inflammation of the angles of the mouth, etc. Nonspecific gingivitis and stomatitis. The mouth harbors a dense population of commensal microorganisms. These are usually controlled by the oral hygiene. If it is neglected, organisms proliferate on the mucosa and gingivitis or generalized stomatitis. Non-specific infections may occur when resistance to the commercial population is decreased by febrile illness, anemia, etc. The gums are swollen and painful and the mucous membrane becomes red. Treatment. In otherwise healthy people, non-specific gingivitis may be treated by proper oral hygiene and dental procedures as scaling and polishing. Stomatitis due to deficiency of nutritional factors. It may be due to the insufficient intake or impaired absorption of essential food factors. It may be necessary by non-availability of B complex like niacin, riboflavin, folic acid, cyanocobalamin and long-standing anemia. It may be secondary to the pellagra, pernicious anemia and chronic iron deficiency anemia. When the deficiency is acute and severe, the tongue is red, raw and painful. When the deficiency chronic, tongue is moist, unduly clean due to atrophy of the papillae in vitamin C deficiency. Gingivitis, the gums are swollen, painful and bleeding. Ulcerative stomatitis or Vincent's angina. It usually occurs in adults with malnutrition and poor dental hygiene. Ulcers with ragged necrotic margins occur especially on the gums and may involve the palate, lips or the inner aspect of the cheeks. The ulcers are covered by grey slough surrounded by erythematous margin. The direct smear of these ulcers revealed numerous fusiform spirochetes, Vincent's organisms. Usually these are present in small numbers in commercial population of mouth and may proliferate due to the alteration in host resistance. The condition is infectious, so the patient's foot vessels and the cutlery should be sterilized. Treatment. Acute phase response to the local treatment with metronidazole in a dose of 200 milligrams 3 times a day for 3 days or penicillin. After control of acute phase, proper dental treatment is necessary. Surgical correction of deformities resulting from tissue necrosis may be necessary. Oral candidiasis. White sloughs covering areas of superficial ulceration appear on the gums, palate, and cheeks and may enlarge to form an easily detectable membrane. In severe infection, the pharynx and the esophagus may also be affected, causing dysphagia. It is caused by the fungus Candida albicans, which is a normal commensal of the mouth. In case of prolonged use of antibiotics, steroids, or in patients with debilitating infections, it proliferates and causes frank infection. Treatment. Painting the oral cavity with 1% gentian violet 3 times a day. Tablets of nystatin 5 lakh units should be sucked and retained in the mouth as long as possible. 4 times a day for 7 days. Abscess stomatitis. It may occur in association with various gastrointestinal disorders as ulcerative colitis. This is a common condition which is characterized by development of one or more ulcers in the mouth, benign as a small vesicle, then develops into shallow or deep ulcers, may occur in crops, may follow emotional stress. The condition is extremely painful. Treatment. In general, the treatment is limited to local application of balsamic resins as tincture of benzoin paint for relief of pain. Secondary infection may be controlled by the use of 2% chlortetracycline mouthwash for not more than 7 days. Some patients may get relief by sucking pellets of 2.5 milligrams of hydrocortisone or local anesthetic. Allergic stomatitis. It can occur as a result of allergy to certain things like chemicals, drugs, toothpaste, dentures, or mint sweets, or local antibiotics. It may also occur in angioneurotic edema due to the metals. Some metals like bismuth, mercury, gold, or arsenic may cause stomatitis. A characteristic blue-black line may be seen at the gum margins in case of lead poisoning. Treatment. Avoiding the metal concerned and in severe cases dimercaprol should be given due to skin disease. The skin diseases like lichen planus, pemphigus, and erythema multiforme commonly involve the mouth, and sometimes oral manifestations may precede the general condition. The tongue. In health, the tongue is moist with a slight white fur on the dorsum of the tongue. The papillae are readily seen. Dry tongue indicates some dehydration or some disease or mouth breathing. In excess smokers, the Fur may be yellowish. It is dry and covered with a dirty brownish fur in febrile disease. Glossitis. In nutritional deficiency, acute or chronic glossitis may be prominent. Simple ulceration of the tongue. It may occur in association with various forms of stomatitis or trauma from the sharp edge of the damaged tooth, badly fitting dentures or biting due to any reason. Chronic ulceration of the tongue. Chronic ulceration always indicates carcinoma, so biopsy is a must in such cases. Syphilis of tongue. It may occur as a primary chancre in the secondary stage as mucus patches or in tertiary stage as painless gummatous ulcers. Leukoplakia of tongue. It is characterized by the presence of white, firm, smooth patches, benign at the side of the tongue and later spreading over the dorsum of the tongue. In early stages, tongue is not painful, but later the patches are split by fissures with the resultant pain and tenderness. The importance of leukoplakia is that it may precede the carcinoma, and the biopsy of such lesion should always be undertaken. Psychogenic pain. Patient complains of constant pain but without any findings on inspection. The findings are obscure and the complaint amounts virtually to delusion. The salivary glands. Excessive salivary secretion. Irritation of or inflammation may cause excessive salivation or reflexly as in trigeminal neuralgia. It is also an important symptom in esophageal obstruction and post-encephalitic Parkinsonism. And some drugs as potassium iodide and heavy metals are excreted in the saliva and cause increased secretion. Treatment. Treatment depends upon the removal of the cause. Symptomatic treatment consists of administration of drugs as atropine, which acts by inhibiting the parasympathetic action. Xerostomia. Xerostomia is defined as the deficient secretion of saliva. Though a dry mouth may be seen in mouth breathers and in persons who sleep with the open mouth, it is associated with the acute febrile conditions, dehydration, diabetes or diarrhea. It is main symptom of Sjogren's disease. The drugs like anticholinergic drugs will depress the salivary secretion. Treatment. The treatment consists of the treatment of underlying cause. Symptomatic treatment consists of use of acidulated sweets, chewing gum, bitter tonics before meals, cholinergic drugs like pilocarpine to stimulate the salivary secretions may be used. If other measures fail in early stages of Sjogren's syndrome, steroids will return the normal salivary secretion. Parotitis. It may be due to the virtual infection like mumps or bacterial infection of the glands. The latter tends to develop during severe febrile illness and after surgical operation. Septic parotitis is much more rarely encountered nowadays. Treatment consists of parenteral administration of penicillin and surgical drainage of abscess formation has occurred. Enlargement of the parotid gland may be noted in sarcoidosis. Salivary calculi. The calculi usually occurs in submandibular salivary glands or duct. They cause pain while eating. Infection is a complication. Treatment. Stones can be felt in the floor of the mouth and can be removed by incision over the duct. Stones in the gland may be required excision of the gland. Tumors. The tumor is a mixed salivary tumor. It is a slow, painless enlargement of one parotid gland. The tumor shows a variable degree of malignancy and is treated by excision. That's all about the disease of the mouth. And in the next video I will discuss about some other disease. Thank you.